In the last clip, we reviewed the principles of calcium and phosphorus regulation, and we reviewed how parathyroid hormone and the 125 dihydroxyvitamin D help regulate calcium and phosphorus by their effect on bone, the kidneys, and the GI tract. Now let's try to put it all together in a scenario. Say you have a friend who reads a lot of stuff on the internet and tells you that he's going to do a low calcium diet just because he thinks it's very beneficial. What's going to happen in the body when there's less calcium being taken by the person? When there's a low calcium in the blood, that is going to be sensed by the calcium sensing receptor in the parathyroid gland. The parathyroid glands will then start secreting parathyroid hormone. Parathyroid hormone, as I showed you in the previous slide on vitamin D, it helps increase the production of 125 dihydroxyvitamin D, which is also known as calcitriol. The parathyroid hormone does that by its action on 1-alpha hydroxylase. It stimulates 1-alpha hydroxylase in the kidneys. When the parathyroid hormone brings about an increased level of 125 dihydroxyvitamin D3, this signals the gut to increase calcium absorption. So whatever little dietary calcium that the person is being exposed to, it's going to be absorbed more vigorously in the presence of calcitriol. Parathyroid hormone also signals the kidneys to increase calcium reabsorption. This is by its action on the distal convoluted tubule. So far, the parathyroid hormone is trying to get more calcium into the system through the gut and through the kidneys. Next, the parathyroid hormone also has an effect on the bone. The parathyroid hormone brings about bone resorption, and so the bone breakdown will then release more calcium into the blood. And once the person's calcium levels again get back to normal, the normal calcium level is again sensed by the parathyroid glands, and then the parathyroid hormone secretion stops. So this is a nice way of trying to understand the different pathways of calcium regulation in the body, mainly through the effect of parathyroid hormone and calcitriol. Let's look at the causes and consequences of oversecretion as well as undersecretion of parathyroid hormone. We'll then discuss the differential diagnosis of hypercalcemia and the signs and symptoms most commonly seen with hypercalcemia and hypocalcemia. It's nice to have this summary slide for reference. So let's look at primary hyperparathyroidism. We discussed how calcium normally suppresses parathyroid hormone release, normal parathyroid glands. So if this guy is like calcium, it's basically suppressing the parathyroid hormone release from the parathyroid gland. However, if the parathyroid gland becomes an adenoma, that is, if the guy becomes a Hulk, then he is no longer going to be suppressed by the calcium, and thus there's going to be a lot of parathyroid hormone release in this situation. And this is to say that in primary hyperparathyroidism, the parathyroid hormone release is not suppressed by increased calcium in the blood. And so let's look at calcium, phosphorus, vitamin D changes that we would see in primary hyperparathyroidism. So there's the parathyroid adenoma, those enlarged parathyroid glands, that's a Hulk, and it's just the adenoma is just secreting a lot of parathyroid hormone into the blood. The parathyroid hormone is then going to act on the bone to increase bone resorption, thus increasing calcium in the blood. The parathyroid hormone is then, through the vitamin D pathway, increase the calcium reabsorption from the gut, and the parathyroid hormone again is going to increase calcium reabsorption from the kidneys. And as a result, there is a high level of calcium in the blood. And what's important to know that this high calcium levels in the blood are not able to suppress the release parathyroid hormone from the parathyroid glands. Also remember that the parathyroid hormone brings about an increased phosphorus excretion. So in summary, in primary hyperparathyroidism, you're going to see an increased serum calcium level because of the effect of the increased parathyroid hormone on the bone, the kidneys, and the gut. You're going to see a decreased serum phosphorus level because there's going to be an increased excretion of phosphorus through the kidneys and into the urine. The decreased serum phosphorus level is usually seen in primary hyperparathyroidism. So to summarize, in primary hyperparathyroidism, you're going to see an increased serum calcium level. That is because of an increased parathyroid hormone that's being released from the parathyroid adenoma. The high levels of parathyroid hormone act on the bones, the kidneys, and the intestine, and causes this high calcium level in the blood. Also, in primary hyperparathyroidism, you're going to see a decreased serum phosphorus because the parathyroid hormone is going to promote urinary excretion of phosphorus. The treatment in this situation is to get the adenoma out by parathyroidectomy. That is, surgically remove the parathyroid adenoma in primary hyperparathyroidism. What are the symptoms of hypercalcemia? This is a common way of remembering it: stones, bones, groans, moans. Stones refer to kidney stones, bones refer to bone pain, groans refers to peptic ulcer, pancreatitis, constipation that is seen with hypercalcemia, and psychic moans, that is confusion, fatigue, and depression. So whenever you're given a clinical scenario of high calcium, these are the symptoms you should be looking for. Now, there is one point of clarification that I need to make. We talked about how in primary hyperparathyroidism, the high PTH levels should increase calcium reabsorption in the kidney. Now, if the high parathyroid levels are promoting calcium reabsorption, there should be less calcium in the urine. If there's less calcium in the urine, how are we going to see calcium stones in primary hyperparathyroidism with the prevalence as high as 30 to 57%? Now, the reason why we see calcium stones in primary hyperparathyroidism is that because there is more calcium in the blood that is being filtered by the nephron. So high calcium in the blood in primary hyperparathyroidism causes more filtration of calcium, more calcium in the urine, and that causes calcium stones. In hypercalcemia, you can also see EKG changes, that is a shortened QT interval. The symptoms of hypocalcemia, on the other hand, are tingling, muscle spasms, tetany because of hyperexcitable nerves. There are these two clinical signs that are important to know. The first one is called the Schwostek sign, which basically means that you're tapping this facial nerve on the side of the person's face, and when someone has hypocalcemia, the nerves are hyperexcitable and you're going to see muscle spasm and the angle of the mouth being drawn towards that side. The Trousseau sign is another sign of hypocalcemia, where after inflating the blood pressure cuff in the person with hypocalcemia, it causes this contraction here, which is called a carpopedal spasm. That is contraction and spasm of the forearm and the hand muscles. I have a video here from an EGM to show you. There was a Schwastek sign, and here they're demonstrating the Trosu sign. So they have the blood pressure cuff inflated to 210, and you can see the spasm happening.